Welcome to Conversations with Sekani, a podcast for people in their 20s who are trying to figure out life and not get lost along the way. Today's guest is Dr. Stephanie Zwonitzer, also known as Dr. Z, a doctor of nursing practice specializing in hormones and sexual medicine. She's the founder of the Revive Institute of Sexual Health and the host of the Between the Sheets podcast, where she helps break the stigma around sexual health through honest educational conversation. Today we explore our journey, why sexual health matters and what every young adult should know about building healthy relationships with themselves and others. Stephanie, welcome to Conversations with Sekani. It's a pleasure to have you on.
Yes, thank you so much for having me. It's such a pleasure to be here. This is a topic that is not talked about enough, so I'm excited to get into it with you.
All right. Okay. So yes, before we do, Dr. Z, can you take us back to your 20s basically? What was it like? What dreams were you chasing at the time?
Yeah, absolutely. So I got married very young. I married my high school sweetheart when I was 19 and had my daughter at 22 and my son at 24. So I got started with adult life pretty quickly and early on. But I was also in nursing school at the time. And so I just had this dream of being a mom and being a nurse and taking great care of patients. And I really had no idea that this is the way that my life was going to turn. Different life circumstances came up and put me in a position where I was able to go back and get my master's and doctorate degree to become a provider. And then I found sexual medicine and really just pulled at my heartstrings because so many people not only individually struggle with their sexual health, but also in relationships. And intimacy issues have really been known to cause breakup issues and divorces and things like that. And so being able to come in and help people through those has been such a pleasure in my life. So, not at all what I thought I would be doing in my 20s, but very grateful for the journey that brought me here.
All
I
right.
cannot
So
hear you.
yes.
There we go.
Okay. All right. So
Got it.
thank you for that one actually. So looking back, what would you say was one challenge you faced in your 20s that shaped who you are today?
That's a great question. Going through my divorce, I ended up having a issue with my spouse, and I don't talk about it publicly because we have kids together. So I'll keep the details of it private. But we ended up getting divorced, and that really made me kind of dig deep and find out what I'm about and what I'm able to accomplish on my own. I had to start fending for myself and raising two kids and, really find that grit within myself that I could push through and do things. And that has allowed me to achieve so many goals over the years because I figured out how to just dig in and get done what needed to get done.
Oof, all right. Okay, so I'll say your story is one of strength, right? Grit and
Yes,
resilience, actually.
very much.
Oh,
Yes.
exactly. Wow. Okay, so now I want us to talk about, your journey, right, and your current
Mhm.
work. So what made you realize that, there was such a huge gap in sexual health education?
Yeah. So when I was working in urology, a lot of patients come in with urinary issues. Obviously, it's urology. We deal with pee. But there are also sexual health issues in urology, like erections and pain with sex for women and different things like that. And what I found was so many people were coming in and they didn't have the words to use. They didn't have the right vocabulary. There's all these slang terms that we use. They didn't know that there's help for certain things. A lot of times they didn't even really know how to vocalize what it was going inside of them. And I realized, man, we've done a really poor job of educating people in sexual health and wellness over the years. And that was really why I started the Between the Sheets podcast, because I wanted to have a platform of education to put out good quality education for people to easily access, to learn the right terms, the right treatment modalities, the different things that we can offer you to have a better sex life. And as I developed that and learned more, that created this internal desire for me to just solely focus my medical practice on sexual health. And so that's when I decided to go ahead and open Revive. And it's been such a pleasure to be involved in such an intimate area of people's lives and help them feel comfortable in talking about it and then being able to help them work through their problems as well.
Wow. All right. One thing is, I like that you said it's really not something most people feel comfortable talking about, right? So there's this, I don't know, there's this shame around it, right? So I like that we
Yeah.
are talking about it. So first of all, what do you think are like some of the misconceptions that young people have when it comes to sexual health?
Yeah, so one of the misconceptions is that porn is reality, right? So porn is at everyone's
Mm,
fingertips now. It's on our phones, it's on the internet, and it's free and it's accessible. When I was younger, it was whatever VHS tape you could find in someone's grandpa's closet or something. And so
right.
you kind of had to sneak around to do it. It wasn't right there. But because it's so right there, we're having younger men have erection issues because they're so used to watching certain types of porn and masturbating in a certain way that then when they're with a partner and those sensations aren't the same, they can't maintain an erection, they can't get to climax. Sometimes they don't even desire partnered intimacy anymore at all. So that's one thing that I really think that we need to work on is understanding that it's just like going to a movie theater. When you see, the Marvel movies and these superheroes doing superhero activities, that's not reality. Neither is porn. Those they're getting angle shots, they're taking medications to keep their erections for a really long time. They're trained to do this. They have people watching them do this that are telling them which positions to be in and getting the right camera angle so it looks the best. So porn is not reality. That would be my first one. And also for women, we really love the lovey-dovey side. And that's a very general statement, but life is also not a Hallmark movie. It doesn't always have a happy ending. You don't go back home and fall in love with someone again over a 2-day holiday weekend. You don't, those kinds of things. And so it's really understanding that reality is very different from what is portrayed on TVs and movies and things like that, so that you don't have misconceptions of what things are. Safe sex is extremely important. You are not going to see in movies people putting condoms on, having discussions about their STD testing and things like that. That is extremely important and something that you need to be doing. A lot of the STDs can be treated with some antibiotics, move on, whatever. Some can't. And some have very silent symptoms and long-term effects on fertility and stuff. So those are really important discussions that I think a lot of people, young or older, don't want to have because it feels shameful or embarrassing to talk about those things. And yet, that is something that if you can't have that discussion with someone, in my opinion, you shouldn't be being intimate with that person. That level of comfort and honesty should be there before you ever get intimate with someone.
Wow. All right. So, while you were talking, I was thinking about this thing I saw on social media, right? And you mentioned it actually. You spoke about masturbation, right? For men, we know that it has side effects, right? For
Mhm.
men. Now, I want to talk about women and when
Yeah.
it comes to masturbation, right? So, there's this
Mhm.
study that says a lot of women cannot actually, should I use the word climax, right? When they are with a man, right? Instead, they climax when they masturbate. So, what is your take on that, actually?
Mhm. Yeah, it's very true. So it's not necessarily single or partnered activity, it's the type of stimulation you need. So 80% of women can climax with clitoral stimulation, which is external stimulation. Whether that is self pleasure with a partner, with a toy, oral sex, using a vibrator, whatever it might be, 80% of women need external stimulation to achieve climax. Only about 20% of women are going to achieve climax with penetration. And again, that can be partner or vibrator or whatever, but most women are not going to climax with penetrative sex. And so it's not so much of the masturbation versus partnered activity. It's really that our clitoris is very large. It's not the one little spot that most people think it is. It's all within our labias, it's under the skin. There's all these layers to it. There are thousands and thousands of nerve endings. Inside the vagina, there aren't as many. So we need that clitoral stimulation to truly achieve a really great orgasm. So I love masturbation for women because you need to figure out what works best for you. Where do you actually get stimulation that turns you on, that gets you to climax? And what kind of stimulation is that for you? Some women, it's a consistent pattern. Some women need variety in their pattern. Some women need faster. Some women need slower. Some women need up and down. Some women need circle. If you don't take that time to learn that for yourself, how are you going to tell your partner what you like? So I'm a huge fan of masturbation for women, huge fan of external stimulation for women, but you can certainly climax with or without a partner. Most women are just going to need that external stimulation.
All right. So I like that you spoke about that. And I think the audience should actually take note, right? For men, I don't think
Yes,
it's healthy, right? But then for women, I think it's healthy because that way you get to learn what works for you, right? Wow.
absolutely.
Okay.
Yeah, and
Now, what?
orgasms in themselves are really healthy for us. They decrease stress, they decrease blood pressure, they release oxytocin, which is a lovey-dovey hormone. So, masturbation is great for men and women. I love it. It just needs to be done in the sense of getting pleasure and enjoying it and not taking away from partnered activities if you are in a partnership, because that's where it becomes a problem, right? It's never a problem to enjoy pleasure yourself. It's only a problem when it takes you away from someone that you are supposed to be experiencing pleasure with.
Mm, right. Wow. Oh, okay. So thank you for that one, actually. So I want us to talk about through your podcast, right? Between the shits. So what conversations do you hope, becomes more normal on your podcast?
Yeah, great question. So we talk about everything on this podcast,
Mm,
from basic biology to super taboo, sexy topics. So I have a variety of guests on, and so we talk about the therapy side of things. We talk about the physical side of things, the emotional and relational side of things. We talk about a lot of stuff. What I love talking about the most is the things that people are afraid to talk about. So I love talking about STDs because people are so ashamed of them and they're so common and need to be talked about. I love talking about mismatched libidos and desires within a partnership because it is so common. And a lot of people, again, feel shame and they don't understand why that's happening. I also love talking about hormones because if our hormones are off, our desire is off, our relationships suffer. And a lot of times we're going to couples therapy and we think that it's a communication issue, but it's really your hormones are off. So you can communicate all you want, but you're still not going to desire sex
mm,
because your hormones are off. So I love talking about all the different sides of sexual wellness so that we can really get a full picture of how best to help someone.
mm. Wow. Oh, all right. Another thing I thought of right now, right? So, yes, in cases where there's a couple, they're both in love, right? But the lady, she loves the guy, but she doesn't feel sexually attracted to him. I don't know if
Mhm.
that makes any sense, right? Yes.
Yep.
What do you think is the reason for that actually? And if there's a reason, do you think it's something that could be solved, or is there like a solution to that problem? Actually?
It's an amazing question because I deal with it frequently, actually. This is not something that
Oh,
is abnormal.
okay.
So, yes, you can absolutely be in love with your partner. You can even be attracted to them, and you have no desire for sex. So, there's a couple things that can be going on here. Number one is hormones. If your hormones are off, you can be in the best relationship ever and never care about sex. You can have low testosterone, low estrogen, your progesterone, or on the other side of that, you could be really stressed and your cortisol level could be extremely elevated and you're in flight or fight response. And if you're in flight or fight response, your body does not care about sex hormones. All it's doing is trying to survive, and sex is not even in the brain. So you might just be in a really stressful phase of life and you have an amazing partner who you love, but you can't even think about sex because you have no money to pay the mortgage. You don't know where your next job is going to be because you just got laid off. All of these other things going on. Your body can't even think about sex. Um, Another thing that can happen is a mismatch in desire. Maybe she has what's called responsive desire, meaning something needs to start her engine, something needs to get her going. And if her partner is just kind of a jump in bed, let's start penetration from ground zero, that could be a total turnoff for her. And so I would say figure out what you need to be aroused. Is that reading a romantic novel? Is that taking an everything shower and feeling sexy and shaving? Is that taking 10 minutes to yourself and having your partner deal with the kids and the cleanup from dinner so you can kind of re-zen yourself and be ready for intimacy? So a lot of times women need to figure out what actually helps them be aroused and allow that to be a part of the routine of getting them in the mood. A lot of people think that scheduling sex is not sexy. It's one of my favorite things because it allows you that time to get into that mood, to do whatever it takes for you to kind of de-stress and get out of that flight or fight mode. And so, just like when you're early dating and Tuesday night is date night, you're probably going to have sex. And so you get yourself all ready for that. You can do that in a long-term relationship too. Tuesday night can still be sexy night, even though you live together. And then you know it in your brain, and you can send each other sexy texts through the day, and you can get each other ready. So there's a lot more that goes on to it than just, don't want to have sex or I don't like my partner or whatever.
Mm. Wow. All right. Okay. I'm glad that you said, I mean, it's not a problem, right? It's actually common. So it's just
Yeah.
for, both partners to understand what works. Sometimes, like you said, it could be the hormones, actually. So just figure out what works for you, basically. So yes, I want you to, talk to the younglings out there, because that is the sole purpose of my podcast, right? Giving advice to the
Yes.
younger generation. So many people in their 20s, they feel, embarrassed to ask questions about their bodies or sexual health. So what would you say
Mhm.
to them?
Yeah, please don't be embarrassed. Find a provider that is going to spend time with you and talk you through. I had a man, and he was 26, and he came in and he was so ashamed because he had been with a female partner who kind of jokingly or purposefully, I'm not sure, said something about his size and that he was on the smaller side. And he came in and he was just completely defeated and said, my penis hasn't really gotten any bigger since I was a teenager. I thought it was supposed to. I don't really know what I'm supposed to do, whatever. And again, that goes back to education. When guys go through puberty, their penis gets bigger, and then it doesn't keep getting bigger throughout your life. You kind of hit this plateau and move on. And there is no one size fits all with penises. Some women like smaller, some women like bigger, whatever. And it's the same for men. Whatever you have is what you have. And so you have to learn to embrace that. This gentleman, I did a full exam on him. He had a perfectly normal penis. Nothing was wrong with him. So whatever that girl said to him was just a jerk and did not, deserve to be with a man who was as good as he was. And so I think it really comes down to kind of tampering your expectations and asking questions, and don't look at the big dicks on porn. Don't look at the big boobs on porn. All of that stuff is fake. They angles, all the things. They take medicines to get larger, things like that. And I don't mean larger like you can take medicines to grow a bigger penis. There's certain enhancements that they do during the filming of these movies. But if you have questions, if you think something is wrong, it's probably not. But ask us. There are so many different vulvas in the world. Every woman's vulva, which is your entire outer labias, vagina, all of that is called your vulva. Everybody's looks different and everybody's is beautiful. It just is different. And so if you think that your labias hang a little bit differently than your friends because you guys saw each other while you were putting on your bathing suits or whatever, that doesn't mean yours is wrong. It's just different. And that's really a beautiful thing because you will find partners that your bodies fit really well together and things are really good. And you'll have partners that it's not very fitting well and good. And that's okay. You'll find the person that, you fit really well with, and that's good too. But most of what is in our head is because society told us, we saw it in a movie, we heard it in porn, something like that, and it's just not reality. If you think that you are too small, too long, too skinny, too thick, you have big puffy labias or really small labias, whatever it is, Google it. I guarantee you are going to find so many people with so many different vulvas and penises that are completely normal. It is very rare that you truly have something wrong down there.
All right. Whew. Okay, thank you for that one. Actually, I feel like people need to learn or needed to hear that, right? Because a lot of these things, I don't know, it's kind of like contributes to low self-esteem, right?
Mhm.
Coming from that comparison. So it's important to understand that we do not have to compare. People are different, right? And you're perfectly healthy. So it's normal. So you're healthy. Right, okay. And finally, I would like to ask, right, what do you think are some daily habits that contribute to, the general wellness of some of the well-being, basically?
Yeah, so the first one is sleep. Especially
Mm.
when we're in our 20s, we don't make sleep a priority, but it is the biggest priority for hormone balancing, for overall health and wellness, for getting your sex hormones the way they need to be. Sleep is so incredibly important. We really need you to get 7 to 9 hours of good quality sleep a night. So not just your head's on the pillow, but really good quality sleeping. So that's number one. Number two is hydration. You should be drinking a lot of plain old water every day. About 64 ounces of water is my baseline for you. Anything on top of that is amazing, but your body needs water. Our bodies are more water than anything else. And so to function at its optimal, we need really good quality sleep and really good hydration. And then move. It doesn't have to be a specific type of exercise or anything like that, but the more you get your body moving every day, the more your chemical processes in your body work correctly and help you have, good blood sugars and blood pressures and balance out your hormones correctly and all of the things that your body needs to work correctly. One of the best advices that I could give you is really think about your toxin intake. So
Mhm.
nicotine, drugs, alcohol. Our society has made alcohol like this wonderful, glamorous thing, and it is a huge carcinogen. It is affects about 11 different types of cancer. It is extremely toxic to our bodies. And so, especially when you're in your 20s and you're finally at the age where you can drink and go out and have a good time, be very careful with your alcohol intake. It screws up your sleep, it screws up your hormones, it screws up your internal organs very frequently and significantly. So cut back or cut out alcohol if you can. That makes a huge difference. So those are my biggest tips.
Oh, okay. Cut out alcohol, drink a lot of water, eat healthy, sleep. Right, very important.
Yes.
Okay. And movement too.
Yes.
You mentioned
Yep.
movement. All right. So thank you for that beautiful one, actually. And thank you for, educating us. This conversation reminds us that, honest communication and self-awareness are actually essential parts of, human life, basically. So thank you. And it brings me to the final segment of my podcast. I call it the rapid fire segment, right? You could either answer with a word or a phrase starting now. So what are three words that describes your 20s?
Ooh, wow, that's a great question. Frazzled and complicated and fabulous.
Wow. Okay. All right. So would you prefer coffee or tea?
I'm a coffee girl.
Okay. All right. So what is one habit you never skip?
Sleeping. I am hardcore about my sleeping.
Okay. All right. So what is a podcast or book that you'd recommend?
Ooh, great question. A lot of mine have to do, a lot of what I'm doing right now has to deal with what I do. So, but I think, hmm, Gosh, I should have prepared for a book. Um, I think, well, my podcast, I think, is a really good one. But am I allowed to plug my own podcast? One of the podcasts, I love the Mel Robbins podcast. I think she does a really great job of giving you, good life advice, and different perspectives that I think are really great to just be a better human.
Wow. All right. And finally, what does success mean to you?
Success to me means that I am helping as many people as I can help while living a well-balanced life and enjoying life and being able to live comfortably within my means, but also not really having to miss out on any of my needs being met. So having a little bit of a comfortable lifestyle.
Wow. All right. Okay. So thank you, Dr. Z. Right. And before you go, where can listeners get to, learn more about you and also connect with you?
Yeah, absolutely. So Revive Institute of Sexual Health is my business. And so everything, social media handles, website is Revive ISH. And so it's at Revive ISH or reviveish.com. You can submit questions or anything there. You can follow me on social media and learn more about all the different sexual health stuff I talk about.
All right. And I'm going to put a link in the show notes so it's easily accessible for listeners. And to my listeners, I want to say thank you for tuning in to Conversations with Sekani. If this episode sparked something in you, just as it did in me, make sure to share to someone who you think might need this. And also subscribe so you don't miss out on new episodes. Once again, thank you, Dr. Z. Do have a wonderful day ahead of you.
Thank you. You as well. Thanks for having me.
All right. Take care.